Hi, John Kanelopoulos from our center here in Athens, Greece, the Laser Vision Vitreous Surgery Center. To our favorite subject, keratoconus, clinical professor of ophthalmology at NYU Medical School in New York City, New York. So this is a young gentleman who we treated back in 2023 with progressive keratoconus on his left eye. He is currently 21. At the time he was 19. You can see the drastic improvement of his keratoconus and the change of the synergistic effect of the topography-guided PRK and the CXL. We have an additive 4.4 diopters flattening at the cone area, 4.5 rather, and 3.6 steepening at the superior area that had flattened. So this sums up to a little bit over 8 diopters. And again, a very normal cornea with a minute refractive error though. So the way we've discussed and we're evaluating this is we're seeing the post-Athens protocol epithelial maps here, and we can see the CXL line going deep into the cornea. The epithelium now over the cone area is naive. We can see the hyperopic arc of the topography-guided ablation, the PTK, and of course the refractive error is bothering this contact lens intolerant young man. He's been stable for over a year. And in conjunction with the fact that his right eye also has a small refractive error, he's about -3, minimal thickness 465, as we can see here, and very subtle changes in the epithelium gave us the go-ahead to evaluate this young gentleman with ray tracing in the right eye. So these are the ray tracing measurements. Again, these Hartmann-Shack wavefront up top, the interferometry to create the virtual three-dimensional eye, and the sine fluke imaging. And we're getting here the low and high order aberrations. It's impressive how stable the refractions are in the -2, -1, and very tight cylindrical axis, all checking as normal. So we use these numbers transepithelially with the streamlined epithelial removal that the Alcon platform offers. So of course we cheat a little bit because you cannot engage the streamlined platform with ray tracing yet with Wavelight Plus. So we treated half a diopter myopia with the streamlight to go transepithelial, and then treated the ray tracing numbers, excluding of course half a diopter myopia that we pre-treated. Of course, the interest here is mainly in the left eye. That is the eye that had undergone the Athens protocol. In the left eye, we're seeing the same philosophy here, action length measurements to create the three-dimensional model eye, Hartmann-Shack wavefront analysis. And we can see the residual coma here from the posterior part of the keratoconus, the normalized topography, sine fluke imaging. And again, here we're seeing the accuracy that the ray tracing platform can offer to the refractive error. Very tight numbers of myopia, a very small amount of astigmatism, but the coma that we want to treat with the higher aberrations that topography cannot measure, because this is mainly involving posterior corneal curvature. So we used ray tracing numbers to treat both the right eye and the left eye. And of course, we are summing up things here today where the right eye looks very much healed. We engage just flash cross-linking here. We are 20/12 uncorrected, and the left eye follows suit. It's the eye that had undergone the Athens protocol previously. Again, we're seeing that the epithelium is relatively naive. He's also 2010 to 2012 here as far as visual acuity, but feels the quality of vision is better in his right eye. And all this is done without, of course, fortunately, this young patient risking any problems with corneal clarity. This is the right eye 6 months after the PRK with flash cross-linking, and this is the left eye that had undergone Athens protocol CXL a little less than 2 years ago, and a Wavelight Plus ray tracing residual refractive error and higher aberration treatment just 4 months ago. Very happy patient, and again, how we can approach and use our modalities, taking that the cornea residual enables us to with the toolbox that we have in order to offer the best possible vision, of course, on grounds of stabilization with keratoconus. Thanks so much for your attention.